Hello everybody. Let's look at the pre-discharge checks that are done on your normal. When do we discharge your baby? We prefer to keep you and your baby in the hospital for at least 48 hours. This are for specific purposes. The most important of which is that lactation or breastfeeding should have been established. For more details, watch the video on breastfeeding part 1 from our team. Your baby should have passed urine and meconium at least once before he or she is sent home. We do 3 vaccinations before your baby is sent home. The BCG vaccine protects against the major or the severe forms of tuberculosis. Oral polio vaccine is given through the mouth, and hepatitis B vaccine is given into the muscle on the lower limbs when protects against hepatitis B virus. There are certain screening tests that we do before we send your baby home. The autoacoustic emission is a simple screening hearing assessment. 2 test results are possible, either pass or refer. And if you see refer on your sheet, don't panic. It just means that it should be repeated at around 6 weeks of age. The congenital heart disease screening is done with the help of pulse oximetry at around 48 hours of life in the NICU step-down room on level 5 in the KIMS main building. Oxygen saturations on the hand as well as the foot are recorded, and if there are any concerns on this screening test, an echo heart may be advised. Neonatal jaundice is very common, and most of them are normal. Neonatal jaundice is assessed either clinically, transcutaneously, or with a blood test at around 48 hours of age where we assess serum bilirubin in the blood. If the value is high, your baby may need to stay back in the hospital for phototherapy. Many times it's not high, but definitely requires follow-up in the next 24 to 48 hours even after you go. What are the normal values of bilirubin? This is a very commonly asked question. But let us remember that it's not a single value. It largely depends on the maturity of the baby, on the blood groups of the mother and the baby, and how well your breastfeeding is going. These are some of the factors on which bilirubin normal values depend. Other blood tests that we do are blood grouping and Rh typing, and we do screen for 2 endocrine disorders, congenital adrenal hyperplasia with the help of the test called 17-hydroxyprogesterone, and thyroid disorders with the help of thyroid function tests, both the TSH as well as the free T4 assessment. Vitamin D, as you all know, is very essential for bone growth as well as for several other functions in the body, including immunity. We found that most Indian mothers and babies are deficient in vitamin D, and therefore at discharge you will be advised to carry home a bottle of vitamin D drops. 400 international units per day of vitamin D needs to be administered to your baby every day till 1 year of age. Follow-up is usually advised around 24 to 48 hours after you go home, and these examinations are conducted in room number 701 on the main building of KIMS. Weight and feeding assessments are done. Jaundice is assessed either clinically, transcutaneously, or with a blood test, depending on the situation. We also would love to know how well you're coping at home, and will advise you on what vaccines are to be done at the next checkup, which is usually at 6 weeks of age, along with your own postnatal. Please read your vaccination book carefully. This will clarify most of your doubts, and for other things, we're always available. Best wishes.